Hi, guys. Welcome back. Let's talk about nursing ethics and some concepts you need to know for your nursing exam or your NCLEX exam. Know the difference between slander and libel. These are the two types of defamation. So, a defamation can happen as a slander, which is a spoken form, or a libel, which is the written form of defamation. So, in both ways, you have whatever you said or you published is damaging to the patient's reputation. Acts of threat and attack can exist in three ways: assault, battery, or false imprisonment. Assault. An assault is an action that causes a patient to have a reasonably apprehension of imminent harmful or offensive contact without consent. It's a threat, not an actual contact with a patient. For example, threatening to forcibly administer medication or threatening that if you don't eat, I won't give you that. And then battery is the intentional, physical, or offensive touching of a patient without their consent. This involves actual contact, such as forcibly administering medications or performing a procedure after consent has been refused. So, if the patient says, I don't want to do this, you cannot force them. If you try and touch them without them giving you their consent, that's battery. If you want to listen to their lungs and you just touch them without asking for permission, that's battery. False imprisonment. This is the unlawful restraint or restriction of a person's freedom of movement. In a nursing scenario, it could be blocking a patient from leaving or using restraints without a legal order or justification for that. Last but not least, I know the difference between negligence and medical malpractice. So, negligence is the failure to act in a way that any reasonable, prudent person would have, therefore causing harm to someone else. On the other hand, malpractice is a type of negligence but specific only to healthcare providers. Malpractice must involve a healthcare professional who is negligent. To be considered malpractice, four elements must be present. As a healthcare provider, you assume the care for that patient, so you are the nurse for that patient. You breach your duty of care, that means you did not do something that a reasonable nurse would have done. For example, you incorrectly or inadequately assess your patient. And then, number three, whatever you did caused injury to your patient, and the patient has to suffer damages, extra cost of tests, procedures, loss of life, etc. Thanks, guys, for watching. Subscribe and watch out for more. Until next time, bye.